Hi, I'm Dr. Paul, and welcome to another episode of the Car Injury Doctors Network. And what this is a group of doctors that have been specifically trained in what's called high sensitivity, high relevancy documentation to stop low ball offers. And that's exactly what we do with the Car Injury Doctor Network. Now, today's specific topic is how is it and why is it that the MRI will force attorneys to accept lowball offers in 68% of the cases? And that's true. And let me show you exactly how that works and how to stop it. So again, I'm Dr. Paul. I've opened 77 offices in 20 states, speaker in 3 chiropractic colleges. Never lost a case in court using this documentation. We teach doctors and attorneys these exact formulas throughout the United States. And some of the results, it started with my result when I took a case from was zero. The insurance company offered zero for a patient of mine. Then we used these tools, these documentation, high sensitivity, high relevancy documentation, and turned it into a $110,000 policy limit award. And that was with no disc injury, no nerve injury, no mild concussion, no fracture. It was a low impact soft tissue spinal injury. And another example is Dr. Kevin in Kansas took a $7,000 soft tissue injury only and turned it into a $350,000 jury award. So this is happening across the United States with doctors that have been trained in the system. In other words, they're essentially members and have been trained in the Car Injury Doctor Network. They're Car Injury Doctor Network providers. So let's go ahead and get started into exactly how this works. So again, the topic is how and why attorneys are forced to accept lowball offers about 68% of the time when they're just using the MRI. Okay, so let me refer to, I just wrote a rough outline on the board behind me to kind of keep it in order. But it starts with the basic information of the car injuries. And so this is from the Car Injury Research Institute, these statistics. So 87% of car injuries are soft tissue injuries. Only 32% are disc injuries. Only 16% have a nerve injury. Only 10% have a mild concussion, and only 2% have a fracture. Now, again, when we define low impact soft tissue injury, we're talking about an injury under 20 miles an hour, and that represents over 80% of the cases. So it starts right here. Only 32% of the cases have a disc injury. Well, the MRI is an excellent tool, obviously, for a disc, bulge disc, herniated disc injury. But here's the problem. It's only going to be a good test or a representative test in 32% of the cases. So 87% of the cases have soft tissue injuries. And here's what typically the injuries are right here. Now, before we do that, let's go into the top 5 categories of the financial drivers. So the very first and most important injury award category is the diagnosis. If the doctor gives the wrong diagnosis, it can significantly and does significantly hurt the injury award. Number 2 is, was there an impairment? Number 3, was there loss of enjoyment of lifetime activities? Number 4, did they suffer any duties under duress? And the loss of lifetime activities and duties under duress are essentially activities of daily living. And then, which takes you to number 5, is there a prognosis and need for future care? Now, depending on how well the doctor fulfills these documentation categories, will give one of 4, if not all 4, potential injury awards. There's 4 potential injury awards from the doctor's documentation. Number 1 is medicals. Number 2 is impairment. Number 3 is pain and suffering. And number 4 is the prognosis and need for future care. Now, when the doctor gives the wrong diagnosis, remember the diagnosis is the single most important factor. In other words, and typically what most doctors do when they haven't been trained in what's called high sensitivity, high relevancy testing, in other words, doing the right test for the problem, you see, because the MRI is a great test for the disc problem. It's absolutely the wrong test for the soft tissue injury problem. So what is when the doctors have not been trained in high sensitivity, high relevancy testing, they give generic diagnoses. The most common one they do is like cervical sprain strain, lumbar sprain strain. And it's the worst possible diagnosis that the doctor can give, and this is why. Remember, the injury award starts with the injury diagnosis. Well, if there's an injury diagnosis, there's no impairment. And impairment's the second most important factor in the injury award. If there's cervical sprain strain, there's no impairment. And there's also no impairment indexes. So we can't do the loss of enjoyment of lifetime activities or duties on the rest because those are impairment indexes. In other words, those have been determined after the patient has reached MMI. Which takes us to the fifth category of the injury award, the prognosis and need for future care. Well, if there's no impairment, there can't be a prognosis and need for future care. So the doctor who doesn't know high sensitivity, high relevancy testing will not give the right diagnosis for the soft tissue injury. And remember, that's 2/3 of the case. That's 68% of the cases right there. And that's why you're stuck with a low ball offer, because you got the wrong diagnosis, no impairment indexes, and no prognosis and need for future care. And unfortunately, that's what most doctors are doing. And so they have to learn personal injury documentation outside of school, just like attorneys learn personal injury outside of law school. Well, if chiropractors or doctors did not take courses specific in personal injury documentation, they do what's called low sensitivity, low relevancy testing. I'll give you an example, and then I'll show you what should be done. An example of one test is if we look at the ranges of motion. Each joint in the neck, the back, etc., has 3 ranges of motion: active, passive, and joint motion. Well, active range of motion is typically cleared up at MMI. Now that's called low sensitivity test. In other words, it's the wrong test for the particular problem, because where is the problem? Is it typically an active range of motion with a low impact soft tissue spinal injury? No. I'm talking about an MMI now. Where are the problems at MMI with low impact? They're at overpressure. They're in the overpressure range of motion category, and they're in the joint motion category. Now that's called high sensitivity diagnostic testing. And it has to be learned outside of chiropractic college or medical school. Most doctors don't include it in their notes at all. They haven't been trained to. So let me share with you exactly the injuries that do occur. The most common injury, and that's what we're going to look at right here. Now there's good news and bad news about this. That's the bad news. The good news is most of these cases that these doctors give cervical sprain strain do have some form of an impairment injury. And let me go into that. So when we talk about soft tissue, low impact soft tissue spinal injury cases, we're not going to be talking about broken bones and ruptured discs. That happens at high velocity collisions, not low impact collisions. The tests that are positive and the problems that patients have are with abnormal spinal biomechanics. And what's the number one reason for abnormal spinal biomechanics? It's subligamentous lesions. Either that is a standalone, or that combined with scar tissue healing, which decreases elasticity. So when you look at the combination, or one of, when you have minor subligamentous lesions of the spine, it alters how those spinal bones move. Okay, now that's very important. Why is that important? Well, the spine is the number one structure of the body, allows for flexibility, and it protects the central nervous system. So that is a huge difference between a subligamentous tear or lesion in the neck versus, say, if I had the same degree of a subligamentous lesion, say, in my distal finger right here. There's no central nervous system. It doesn't support my body. It's almost, depending on what I do, it can be almost irrelevant. Well, not in the spine. The spine's relevant for everybody. So what are the most common soft tissue spinal injuries? And this can only be found by what's called high sensitivity documentation. In other words, doctors have to learn this outside of medical school or chiropractic college. It's altered intersegmental spinal motion. Now, let me also share with you this before we get going. You go, well, how important is this? Well, it's very important because it causes pain and restrictions with activities of daily living that are permanent. Now, these injuries are permanent. See, once there's a ligament that has been slightly torn to whatever degree, doesn't matter the degree, ligaments never go back. They're not like rubber bands. Once there's a subligamentous lesion, it's instantly an impairment rating. Instantly. It never goes back to normal. And the impairment rating, combined with pain and restrictions with activities of daily living, are the single two most important categories for the injury award. So let's go into what are the diagnoses and what are the prevalence of diagnoses that the doctors that you should be seeing routinely with low impact soft tissue spinal injuries. And it's not an MRI. How is it found? Well, the number one by volume, the number one injury that you should be seeing 70 to 80% of the time in a low impact soft tissue spinal injury is called altered intersegmental spinal mobility. Altered intersegmental spinal mobility. What does that mean? Well, you take two vertebrae and you have the ligaments and tendons and tissue all around it, spinal cord running through it. What happens is there's a little bit of subligamentous tearing. It could be of varying degrees, but here's the problem. These spinal bones should not be slipping at all, zero. And we can measure that, and we measure it by motion x-rays. In other words, we take an x-ray of the patient bending all the way forward, take the picture, bending all the way back, take the picture, to the right, to the left, take the picture. And then we can measure the bones because the primary source that holds the bones together are the ligaments. So if the bones are not being held together, in other words, the patient bends forward and we see one spinal vertebra moving on the one below it, we know the cause of that, subligamentous failure. That's what that is. And then we can measure it. We can quantify it. And here's the deal. If it's over 1 millimeter of what's called translation, moves like this, that's pathological and it's an impairment rating. If it's over 7 degrees of angulation, that's subligamentous failure and it's pathological and it gives an impairment rating. Now, this is found on as much as 70 to 80% of the cases. In other words, you should be seeing that diagnosis come across your desk 70 to 80% of the time before cervical sprain strain. Now, that's if those ligaments slide a little bit, whether it's the neck or the low back. If they slide a little further, in other words, there's a little bit more of a subligamentous lesion, in other words, it gets worse, then it's called AOMSI, alteration of motion segment integrity. That happens in about 25% of low impact soft tissue spinal injury cases, 25%. Now, the next one is rotational malposition. And this is very common. And here's what happens. In the neck, when we bend your head to the right, the spinous process and the vertebra should turn, the spinous process should turn to the left, the opposite direction. It's the opposite in the low back. But in the neck, when you bend to the right, it should turn to the left. Well, that's very easily seen on an x-ray, and it's measured. We can see if it's not moving at all. We can see if it's moving in the wrong direction to the side that you're bending to, and that's obviously way more significant. And we can see if it's normal. Is it rotating to the normal position? Well, that's called rotational malposition. Now that happens in the low back too. We can bend to the left and to the right. And by the way, in the low back, that's the single most, by volume, that's the single biggest injury by volume with low impact car injury cases for the low back. Lateral flexion malposition. And it's the same thing. We just have the patient bend to the left and to the right, take the picture, and then we can literally get out a ruler and measure these things. And it's 100% objective and it's 100% quantifiable. As a matter of fact, you heard me reference a case in the beginning where I took a patient's case from, they offered nothing. We took it from $0 to $110,000 policy limit. Well, this is exactly what happened. They went to the emergency room. They did irrelevant diagnostics, low sensitivity, irrelevant diagnostics. So they didn't even find the problem. Well, she kept having the problem. So a few months later, she goes to her GP. Well, he does the same thing. He's just looking, she had the MRI that was normal. So she didn't have a disc injury or a fracture injury. She had a soft tissue, altered spinal biomechanical lesion, but neither of the medical doctors did the test because that's not what they're trained in. They're not trained in altered spinal biomechanics. So you actually had to do what's called a high sensitivity. So I took the patient, did the test, and there was absolutely no movement. It was just totally fixated. She had full active range of motion, but all the motion was occurring between the thoracic lumbar segment and her pelvis. The bones themselves were just totally fixated in the low back. They should rotate to the same side. In her case, they were rotating to the opposite side. Well, that showed a significant pathology. She had significant lumbar lesion. See, that's called a high sensitivity test with high specificity that the MRI would never have been found, because the MRI is a static test. It does not test for altered mechanics, and altered spinal biomechanics are the primary problems with low impact soft tissue spinal injuries in roughly 2/3 of the cases. So you've got rotational malposition, you got alar ligament. Now that's the ligament that essentially holds your head under your spine. That becomes very important if the person has been T-boned. That slips, and it's very easy to see on an X-ray. We just open the mouth, tilt to the right and to the left, take the picture, and we can literally see the slippage. We can measure it. We can measure the subligamentous failure 100% objectively on an X-ray. That's called high relevancy testing, high sensitivity testing. In other words, we're doing the right test for the right problem. And by the way, an MRI would not show that at all. So same with lateral flexion malposition. We talked about that in the neck or the low back, or what's called McNabb's line, where the spine actually jams on itself. We can draw lines and measure that also, and that's due to subligamentous failure also. And by the way, the most common injury that you'll see is altered intersegmental spinal mobility. That's the most common. Now, how does this compare to your injury award? Well, if you get the MRI, to 68% of the time, it's the wrong test. So you're going to typically get the cervical sprain strain, lumbar sprain strain, which is a terrible diagnosis, very generic, terrible diagnosis. Does it give an impairment rating? No. Does it fit into an impairment index? No, you can't have an impairment index of activities of daily living if you don't have an impairment rating. Do you have a prognosis and need for future care? No. So in other words, the doctor who does not know only does not know high sensitivity, high relevancy diagnostics, which most doctors don't because it's not taught in medical school or chiropractic, are going to give you the cervical sprain strain. And so right now, you're 0 for 5. These are the top 5 financial drivers. That's why you're stuck with lowball offers. It's because the doctor does not know. Now, the doctor's in a state of unconscious competence. He doesn't even know everything that I just told you in the last 10 minutes. He hasn't been trained in it. How do I know this? I teach personal injury across the nation. 95% of the doctors that come to me don't know what I just told you in the last 10 minutes. So now let's take the same patient and go, okay, what's the likelihood, instead of giving the diagnosis of cervical sprain strain, what's the likelihood they're going to have altered intersegmental spinal mobility? It's 78%. So there's a high probability. LMSI is 25%. So that's what we should be seeing, is altered pathology. So how does this relate to the injury award? Okay, so you got the right diagnosis, high sensitivity diagnosis. Does it give an impairment rating? Yes. Gives an impairment rating from 10 to 25%, whole body. And again, why? It protects, it support, allows for flexibility and mobility. Those ligaments and holding that spine together is unbelievably important for human life, activities of daily living. So in this case, when we have our car injury doctor network providers that do this, that document this properly, you get the spinal pathology, you get the impairment rating. So right now we're 2 for 2. Now we'll go ahead and we have the ability to document the activities of daily living. And what's interesting about that, remember I said active range of motion is typically normal. So we do not evaluate the activities of daily living, the loss of enjoyment of lifetime activities and duties under duress. Remember, that's the third and fourth categories for financial reward. Remember how important impairment relative to pain and restrictions with activities of daily living are the two most important categories for the injury reward. So we do what's called, again, high sensitivity testing. We don't just test it in active range of motion. We test the impairment indexes in overpressure range of motion because that's where all the pain and restrictions are. And I'll give you an example. The lady patient that I was referring to earlier that we took from $0 to $110,000, she had normal active range of motion. In other words, she could bend and do things like this. Matter of fact, if you just kind of looked at her walking down the hall, she'd look normal. But when she bent over to pick up tried to pick up a basket of laundry, she couldn't. Or when she bended over to try to pick up her 6-year-old daughter, she couldn't. She couldn't because it took her past active range of motion into overpressure range of motion and joint motion. And that's where all her pathologies were. They were in overpressure joint motion. And that's what the emergency room doctors and the general practitioners did not diagnose at all. They didn't do the proper test. So we diagnosed it. We showed the pathology. It was very easy to see normal versus abnormal. And we fulfilled all the other categories. She had mechanism of injury. She had a couple injury magnifiers. She had subjective findings at MMI that were permanent. She had hybrid findings at MMI that were directly related to the mechanism of injury. And she had 2 totally objective findings relative to the mechanism of injury. She had all the major categories to fulfill the documentation to fulfill a policy limit award. So that's why it went from nothing to a policy limit award. And the only difference was high sensitivity, high relevancy documentation. And that's exactly what we teach in the Car Injury Doctor Network with our providers. So we have our providers throughout the nation, and they learned all these documentation, high sensitivity, high relevancy documentation. In other words, get the right diagnosis, do the right test. In other words, if you have a soft tissue injury that's causing spinal biomechanical problems, the MRI is not the test. Now, it's a great test if you have a disc, but remember, a disc bulge, disc herniation will not be there 2/3 of the time. And 70 to 80% of the time, the altered biomechanical subligamentous failure will be. That's where and then everything falls in line from there. So this is exactly what we do in the Car Injury Doctor Network. So that's the difference between a doctor who doesn't know documentation or an attorney who thinks the MRI is the end all. In other words, push, because we have that every now and then. We have attorneys that say, "Oh, just do an MRI," when there's no clinical findings reason why to do it, because they don't have a disc problem, but they do have altered spinal pathological motion. That's what they do have. And it's a totally different test that captures it. So we do a dynamic x-rays. That's what captures altered intersegmental pathological motion. MRI is static. Won't detect it. That's the difference it makes. So for more information, you can just reach out to your local Car Injury Doctor Network provider. They've been trained in all this, in the documentation, the diagnosis, the impairments, how to document loss of enjoyment of lifetime activities, duties under duress, and prognosis. So in this particular example, our doctors are 5 for 5. So we'll fulfill the category of medicals. We'll fulfill for the injury award. We'll fulfill the categories of impairment. We'll fulfill the categories of pain and suffering. And we'll fulfill the categories of prognosis and need for future care. So we'll fulfill all 4 injury award categories, and that's how we'll stop lowball offers. But that's also why the MRI is the wrong test for 68% of your problems. And if that's all your doctor's doing, you'll be forced to accept a lowball offer. So reach out to one of our local Car Injury Doctor Network providers, and they'll give you more specific information on exactly how all this comes together and works. We'll look forward to seeing you on the next episode.